Welcome to AFD TV. I'm Dr. Sam here with Ashley, our new medical director of our AFD Wellness Clinics. Thanks for being here, Ashley.
Thanks for having me.
Today we'll be discussing, is fibromyalgia real? First of all, what is fibromyalgia? That's a very common question we get.
That's a great question. Fibromyalgia is just basically an oversensitivity to pain. Even the lightest touch like this can hurt somebody really bad with fibromyalgia.
So who do you see it more in?
See fibromyalgia more in women, especially middle-aged and older women.
And what types of things do you do first on women or patients who have fibromyalgia?
Well, we'll ask them what kind of lifestyle they have, how long they've had the symptoms, what type of symptoms they're having. In the diagnosis of fibromyalgia, that you typically look for pressure points, what we call them, and there's about 18 different pressure points, and you have to have about 11 of them or so to be considered to have fibromyalgia, like over the shoulders here, the elbows, over the hips. Those are some pretty common areas that are just overly sensitive to pain.
And how do you normally treat fibromyalgia?
Fibromyalgia can be treated with prescription medications, over-the-counter, like anti-inflammatories, NSAIDs. It's really very responsive to gabapentin. Lyrica is another great treatment for it. I also check for low vitamin D, which is very common in fibromyalgia, and then treating the vitamin D deficiency usually helps alleviate symptoms as well.
Great. Do you think any of it's hormonal related?
It can definitely be hormonal related. I'll run a hormone panel for anyone I suspect with fibromyalgia and correct any hormonal deficiencies such as estrogen and progesterone and testosterone.
And what percent do you think are women versus men who have fibromyalgia?
I think the majority is women versus men, like 8 to 1 or 10 to 1, some ratio like that.
That's a great point. That's why you have a lot more experience in it than I do. Well, I mean, one thing I try to do for patients who may have fibromyalgia is I hate to label them fibromyalgia. I don't want anyone to feel disabled. Antidepressants are quite often good. It can help decrease pain sensitivity and get their mind off of pain, and trying to find ways to keep them energized and focused on life and living, so that way even if they do have pain, hopefully they don't notice it. Yeah. The last thing anyone with fibromyalgia needs to do is sit at home in a couch disabled from it, not working, because then they have all the time in the world to focus on the pain.
Yeah.
Just like anything else, whether it's arthritis, asthma, or fibromyalgia, obviously the best thing is to be active and working and productive.
Right.
So.
Proper diet and exercise are very important. A new emerging treatment for fibromyalgia, the studies are starting to come out now that a lot of women with fibromyalgia have an oxytocin deficiency, and so that's a new treatment I'm offering at our clinic, that we're offering at our clinic for women with fibromyalgia. It just really helps immediately decrease the sensitivity of those pain receptors in the skin, and within 10 to 15 minutes the pain sensation has greatly decreased. So it's a great new treatment for fibromyalgia symptoms.
Well, great. Well, thanks for joining us, and be sure to like our Facebook page and subscribe to our YouTube channel so you can keep up with all the news and services we are offering. See you next time.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Myatt and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.